Rainy season has come, and so do mosquitoes. Year after year, mosquitoes remain the world's deadliest creature, threatening half of the world's population. Hi, my name is Julie Cañete, and let's talk about dengue and how can we protect ourselves. Dengue disease is now endemic in more than 100 countries, particularly in Southeast Asia, Central America, South America, and the Caribbean. In the recent decades, the incidence of dengue has increased dramatically that about half of the world's population is now at risk. This illustration shows the incidence of dengue in Thailand from 2004 to 2017. With people between ages 15 to 34 being the most commonly affected. The Aedes aegypti mosquito is considered as the primary vector, caused by 4 closely related dengue viruses, and humans serve as the primary reservoir. How is dengue transmitted? Let me explain. Dengue infection is spread by the bite of a female mosquito from an infected person. After about 1 week, the mosquito can then transmit the virus while biting a healthy person. That person gets dengue 4 to 13 days later. The most common symptom of dengue is high fever. This also includes headache, nausea, rash, aches and pains, typically behind the eyes, muscle, joint, or bone pain. About 1 in 20 people who get sick with dengue will develop severe dengue. Some of the symptoms include severe abdominal pain, convulsions, diarrhea, bruising, vomiting blood or stool, bleeding from nose or gums. Some complications associated with severe dengue include severe bleeding, organ impairment, or plasma leakage. Severe dengue has a higher risk of death when not managed appropriately. There's no specific treatment for dengue fever. Patients should rest, stay hydrated, or seek medical advice. Several methods can be used for diagnosis of dengue infection, depending on the time of the patient presentation. Some examples are PCR, antibodies detection, or CBC. A good way to get rid of mosquito bites is to avoid mosquitoes. Health officials urge the public to eliminate mosquito breeding grounds such as containers with standing water. This reduces the number of mosquitoes in their habitats, therefore lowering the risk of diseases transmitted through mosquito bites. Community engagement, educating the community on risk mosquito-borne diseases, and engaging with the community to improve participation and mobilization of sustained vector control. Together, we can avoid dengue and other mosquito-borne infections by keeping our environment clean and removing stagnant water. Because if they breed, we will bleed.